Hi, do you find yourself feeling anxious or depressed, struggling with addiction or substance abuse, or just not feeling well enough to handle living life on a daily basis effectively or as you used to be able to? Then you might need to look into seeking out mental health treatment services. You should know help is available to you, your loved ones, and anybody you may know who needs it, and all you need to do is seek it out. My name is Ashton Phillips. I'm the owner of a cognitive behavioral therapy counseling clinic. And I want you to know that me and my fellow counselors are here to help you in whatever needs we may be able to assist you with, whether it be mental health, addiction, or etc. If you need it, we're there for you. One of the focuses of cognitive behavior therapy is to give the client the skill or ability to adapt and view their world and their problems in a more positive or productive manner. To do so, there are some techniques and skills a counselor might employ that they have spent years training and being educated on to achieve the desired result. Cognitive restructuring and reframing are techniques used to change the client's perspective and cognition in the efforts of allowing them to see their problems or habits in a different light. Guided discovery is used by counselors to familiarize themselves with clients' viewpoint and from there challenge those beliefs and values in efforts to broaden your horizons. These are just a small sample of the many different techniques used in cognitive behavior therapy and that might be used by the counselors in this very. CBT has been around since the 1960s, and to this day has been studied and developed to the point where it is now one of the most common and effective approaches to therapy. Numerous research studies suggest that CBT leads to significant improvement in the functioning and quality of life. In many studies, CBT has been demonstrated to be as effective as or more effective than other forms of psychological therapy or psychiatric medications. A quote directly from the APA website, also known as the American Psychological Association, on cognitive behavior therapy. Also, as mentioned earlier, it is one of the most commonly used approaches in counseling, and that is due to its effectiveness. To coincide with these points, I discovered a survey that was conducted determining the effectiveness of CBT. This survey found 269 meta-analytic studies over the efficacy of CBT and used a sample of 106 of those meta-analyses on topics like substance use disorder, schizophrenia, and other psychotic disorders, depression and dysthymia, bipolar disorder, anxiety disorders, somatoform disorders, eating disorders, insomnia, personality disorders, anger and aggression, criminal behaviors, general stress, distress due to general medical conditions, chronic pain and fatigue, distress related to pregnancy complications, and female hormonal conditions. Additional meta-analytic reviews examined the efficacy of CBT for various problems in children and elderly adults. And throughout this survey, the common trend was CBT to be one of the most effective means of reducing whatever affliction the participant in the study was experiencing. Life is hard and affects some of us harder than others, and that's okay. Just because you're struggling or in a bad place does not mean you are not deserving of being able to live a happy life, and with CBT, that's our goal here. I know your journey may not be easy and require an extensive amount of time to get you to your desired results, and I want you to know that me and my team are dedicated in assisting you on this potentially long road and getting you to your goal point. So thank you, and we'll see you when you come in.